Hi, I'm Dr. Pannozzo. Thanks for watching our program. The patients you're going to see are regular patients from my practice. Whatever they say on camera is how they feel and what they want you to know. So enjoy the program, and if you have any questions, write in and we'll answer them. Thank you. Lift the weights again, huh?
Yes.
Lifting too much. Drop.
Not too bad there.
Not too bad there.
Right there.
Hold it up. That's good. Where's the pain? Ah, okay. You've been lifting weights.
Mm-hmm. Right in here.
Yeah, it's a biceps.
Bicep tendon.
Yeah. All right, biceps.
I will.
Let me know when I reach it.
Down a little further down, I think. Not yet. Yeah.
Right there?
Mm-hmm.
There's a nice teaching, this is a nice teaching case, because it wasn't actually the shoulder involved, it was a biceps tendon. Now why is that important? Because unless you take care of this biceps tendon, when it gets irritated like that, pulled out of the bone, it becomes what we call friable, and it doesn't really heal up good enough. And so it lays down bone, which makes it weak, the tendon. So in order to keep it from breaking, because this will break right here and your muscle will end up down here.
Right.
You've seen this kind of people.
Yes.
I had a bricklayer one time, had both triceps gone.
Wow.
He couldn't work.
Yeah.
I mean, it's just impossible.
You feel it here.
Yeah, oh, you feel it down there
Oh,
too?
you feel it down there, yeah.
Okay, so that's the other end of this.
Yeah.
So this should be all right. But this is where the tendon is. This is muscular tendon.
Right, okay. All right.
Yep, good.
We're good?
Yeah.
Look, I'm doing it already though. See, because these were very difficult to do. So it's just from that injection, it's, so you saw me originally do it, right? You have it on tape, the original, yeah. So just, pretty good.
Is it okay now?
Feels good?
Feels good?
Yeah, should I take a day off or what? Should I take a day off?
No, you don't have to, but yeah.
Take it.
How are you?
What's bothering you now?
Same general.
Don't steal anything out of there. Seems like a lot of stuff in there.
Maybe that's why my back hurts. It's too heavy. So when I
That's how you hurt your back.
Oh yeah. When I left this leg, anything kind of associated with this leg, it's hurting back here.
Oh, you have trouble climbing steps? Hold this here?
Like when I'm squatting, but like with a lot of weight, like yesterday I only got to 115 pounds, and it's
More than I weigh.
bothering me.
No, that's not true. Hold this up here. Don't let me push it down. No. That's it. Hold this one. It's okay?
It's okay. I don't need anything else in my back.
Yeah, well, let me see. No, that's good. Now, let's see your back. That's it. Where is it here?
Yeah.
Oh, right there?
Yeah.
How about here?
A little bit on the right side too, but more on the left.
More there, and
Yeah.
that bothers you bending?
Yeah.
Okay. All right, we can take care of that. This is,
Yeah, like right here, I feel it. Like
yeah, it's
when
a joint.
How do you feel?
Great. Magic.
Magic. That pain leave?
Mhm. Yeah, because it was all in here.
Very good. So let me know how you are. We don't give appointments, so if you have to come in, come in. The vertebrae will rotate back into normal position to bear weight. This is a physics concept. And if you understand it, how it's made and what it's supposed to do, why, you'll do great. Now, try the exercise to the right.
And you said move to the right?
Yeah, really push it though. I mean, not down, but like this. Really push that thing. Okay,
Okay.
that's all you gotta do.
Okay.
Tuesday, Wednesday, good on it. So let's say today is Thursday. Let's say I feel good. I don't want to. I mean, if I feel something, it's okay. I have something going on. But when I woke up this morning, when I got out of bed and I went like that, and I felt.
No, you get as good as you want to get.
Okay, so come
It's all
see you.
blue.
Doesn't matter. Just come see us. All right.
Let me see right there.
Staying straight. Oh, okay. All right.
This is not as good as it could be. And how come you got this? What happened?
Yeah, I could run on my toes a lot. And like about 3 years ago, I just felt pain every night after I come from running. And the back of my shoe started cutting. So then I realized plantar fasciitis, whatever. So
No, that's not good.
so it pushed back.
That's Achilles tendon,
Yeah. So
where it goes into the bone.
so that hurts.
You had a stress on it and it laid down calcium and fiber as it to repair it.
No, but I can walk and no problem. This is about 3 years old.
Yeah.
But when you touch it, it hurts. When you
Let me
touch
show
it.
you what you actually have. See, this comes up nice?
Mm-hmm.
This doesn't. This is a hip problem. This hip will cause this. Now, there's nothing wrong with this knee.
No, that blue duck is ligaments.
Ligament. Okay. That's all. Just covers it.
But yeah, oh.
And it's right here.
Right by this middle finger.
Yeah, right there. And this is because, I don't know, I had to pick this up before. Did we ever shoot this out? Well, we gotta do that. Now what happens when this knee is used, it's supposed to be used here, but your hip won't rotate. So it's used here, but the knee will actually make that turn for you. And that pulls on here. But when you look at it, it's normal, nothing there.
Nothing, yes.
No heat, no swelling, no nothing.
No.
Just a pain in the ligament.
Yeah, yeah.
So that's not a knee problem. That's a knee result of a problem.
With the hip. Now we you gave me some stretches Monday, and I've been doing them twice
Instead
a
of
day.
injecting it.
Yeah.
Okay. Well,
So I don't
you
know.
probably want to inject it.
So when you say hip doc, you're saying okay something
Yeah.
because it's the right knee. You're saying like
It's right here.
so what
If
could be
this
my
doesn't
situation?
rotate out, this won't be placed in the right place to work. So you're going to get from here to there somehow. You'll make yourself do it. And so your knee will rotate out and pull on that, especially when you have weight, your whole weight on the body.
No, nothing to do with.
No, it had nothing to do with the back. No. As soon as I take care of it right here, you're going to see a big difference. You didn't exercise it enough, did you?
No, I
Tell
didn't.
me if you.
I didn't.
I know you didn't at all.
Yeah, no. I
What do you want? Had you exercised it like we showed you, you wouldn't have this problem.
Well, I did the stretches. Which is to me, I did this. And did this.
Well, how much did you do then?
Well, about 5 minutes.
Yeah, did you really stretch it out? Because when I'm examining, you haven't done it at all.
It's tight. Right?
Yeah.
Yeah, no.
He needs the injection.
Yeah, so I just went easy on the stretches, but no, I didn't try to run on it or anything. And you said keep it moving. You said try to keep it.
Yeah, well, this is your exercise for it, and if that doesn't work, then you have to inject it. It's just a ligament, that's all. Comes right out. You'll see the big difference right in front of your eyes. Come on back. Okay, so anyway, see there's a little bit of a black. That's all you got there.
A little bit of black.
There's space there. Usually we don't even see a space, but that's a needle right in it. And that's it. That should take care of it. Now, in a couple of minutes, you're going to be able to bring this foot up to here.
Okay, but the little black. What's that says? What that means?
Inflammation
In the hip, in
in the ligaments.
the ligament up here.
Your hip is wonderful.
Hip is wonderful, but inflammation in the ligament up here
Yes, right.
causing.
Yeah, so once you get an injury, the ligament structure is what gets injured. It's a bone-to-bone connector, and what it does is tighten down. When it tightens down, you lose the range of motion. That's how it's diagnosed.
Could his injury
It's so
on his,
simple.
on his
I mean,
foot
why
have
people
affected
miss
how
it?
he walked and
Yeah,
stuff?
could-
or
Could this
Yeah,
this-
that's all secondary.
all secondary? So like how normal, like the next one normal, whatever. But over the years, 46-year-old guy. Then about 3 years ago, after I run, I feel pain, but I kind of like okay, it's just. But I noticed I had to go a size up on the shoe because of that back there.
Yeah, well,
But-
that's what happened. Very
Is,
subtle.
this could be anything to do with this.
It is, I think it's direct. It's direct.
Could that be injected too?
You could buy it.
That in itself, Doug, I should just ignore that, leave that alone since it doesn't bother me.
If it doesn't bother
You
you.
said it was painful to the touch earlier.
Yeah, well, like so I'm good. No, don't worry. That I could walk on it, no problem.
Well,
But when
here's-
Doug squeezed it just now, I felt.
Here's what happens, when we took the pressure off because of the hip, that'll
That you were
dissolve.
saying like a person could have a pain. I read this article that you had out that a person could have a pain starting from the back that's causing here. That's
So it
causing
doesn't
pain.
go that way, because if you have a pain here, it goes straight down, like this, at an angle.
So there's nothing with the back, nothing to do with the back on this.
Well, how that is affected is a curvature. If you're not straight, if your spine isn't straight, then you'll hurt it here and hurt it here. Do you have all that?
Of course, yes.
Much
Much
worse.
better.
That better be my.
It was stopping right here.
Yeah.
Push it up, now it's coming up. And you do exercise.
Do the stretches you showed.
Yeah, at home. Really
Well,
working.
Okay.
I mean, put your legs way out. And when you do it, you want to feel it.
And hold it. All right, and then
Hold
another.
it for 6 counts.
All right.
1, 2, 3, 4, 5, 6.
I'll just
10
call
times.
you on
1,
my
2,
way
3, 4,
first.
6. 10 times.
Now listen, Doug. Let's say I'm good. Let's say I'm feeling I'm good. But let's say 4 days I feel something, whatever. Come back or just or
Yeah, right.
picture.
It's up to you. You create your own program here. Everybody does.
Okay, okay.
If you don't need me, don't come back. Unless you want to drop off a cookie or something. Is he hitting the ball?
Yeah,
Wow.
not bad. I played with him. I was just playing with him, and I was telling him what was bothering me. And he goes, "You got to go see this guy."
I worked a long time on him. Sign this.
Sorry.
So you play golf. That's your whole life, huh?
No.
No?
Not at
Okay.
all.
All right. Is that when you get to trouble, though?
Actually, it was nagging. It was nagging me, and I played pickleball last night, and I hadn't played in a while. And when I got done, I had like just a little bit of pain, and when I got done with it last night, literally I couldn't shake anybody's hand. So it's radiating. It's radiating down from my whole arm all the way to the thumb.
What is pickleball?
Pickleball is the fastest growing sport in America.
It is?
You never heard of it? And I saw your Arizona.
Tennis.
What it is, it's like a hybrid of badminton, table tennis, and racquetball. And you play indoors or outdoors. It was the first time I ever went and played outdoors. I was playing before. And what it is it's like you play with a composite racket or a wood racket, and the ball is like a hard wiffle ball. And the court is
It's an offshoot of tennis.
well, it's not really an offshoot of tennis because the strategy and everything is much faster paced than tennis, and you don't really stand in the back and volley. Everything happens fast. Maybe the whole game, the points are maybe 5 or 6.
All right. So you have trouble hitting?
No. Okay. I have pain. Yes. If I right now I can't pick up like
Okay. Where is that pain? At elbow?
from the elbow all the way down to my hand. It hurts me to take a golf club out of the bag this morning. Like this hurts. If I go like this, it hurts. If there's any,
All right. How long has this been bothering you?
probably about 4 weeks. I thought it would kind of subside,
Yeah.
but it got worse. And the problem is, I'm active. I'm never gonna. I mean, if I was inactive for 10 weeks, maybe it would go away. And if that's what you tell me I got to do, I guess I got to do it. But
You don't get that kind of advice here.
Yeah, I'm never going to stop. So I even went out and tried to play golf this morning. I couldn't. Basically, when I got home last
The
night,
grip. It's a grip.
right? I couldn't. I had to put the drink on the left side and drink with my left hand because it hurt me to pick up the cup and go.
Do you have
like
any
this.
treatments?
I've never had anything done.
Shoulder okay?
Shoulder's fine.
And neck?
Neck is fine. Back is fine.
All right. Just wake you up at night?
No. I iced it. I tried to ice it this morning. That hurts. That really hurts.
Where?
Like right there.
Oh, right in here.
Yeah. Right there.
Okay.
My finger's on it.
I got it.
Ah, that hurts. That really hurts. That hurts where you're.
It's not really the elbow. This is a radial humeral
tendon, something.
joint.
Okay. Ow.
And you haven't lost
ow.
anything here.
What?
You haven't lost any extension. Let me see
No.
that one. Turn your hand that way. Let me have it.
Oh wait. What do you want me to do?
Nothing.
Oh.
Let me have it. Let me have it. That bothers you a little bit, doesn't it?
Not where you're. Not there.
Not
there.
here.
No, well,
It's up in here, right?
right there.
Yeah, but
Ow,
see,
well, there it hurts. I mean, it doesn't. Yeah.
that one has a full range. This one doesn't.
No.
You have a loss, maybe 5 degrees on it.
And I'm slicing. I stopped playing because I couldn't hit my golf. Couldn't get the club through.
Pickleball.
Well, the pickleball absolutely killed me because that's all. It's all.
wrist.
It's all this movement.
Yeah.
It's all like I was doing this for about almost 2 hours last night, and by the time I got home, I couldn't. When I introduced myself to people and they shook my hands, I was in pain. It hurts to shake my hand.
Okay, that will be muscular. I think you have 2 problems here.
Okay.
That's one of them.
Yeah.
And the other one's deep inside.
Okay.
So we can take care of this one and see what happens. You need the full extension.
Right. I don't have.
Now have your hand up. Now what do you think?
I don't know. I can't tell. Might not. Oh.
Feel the same to you?
Yeah. No, it hurts.
No. Where did it hurt when I did that? Out in here, right?
Do it again. Yeah. It's now I can
Yeah,
feel it.
it's down in here. Okay, so
Yeah.
that's in the joint.
Okay.
It's a ligament. So you have a ligament, and then this joint here, radiohumeral joint.
Okay.
2 things.
Can I keep the arm?
No,
Oh. So I better get good with my life.
we have to send the arm to California for a couple weeks
Okay.
on the coast for vacation.
Okay.
No, just kidding. We're gonna fix all this today. We
Oh, okay.
do everything by shot,
Okay.
so that you don't waste any time
Okay.
with treatments, therapy, and all that other baloney.
And rest.
And rest. No, we don't want you to rest.
I-
Can't afford the rest. You
If
got to
told
get
me
out
rest 3 days, but I don't know how many weeks of rest would it take for this to get well.
there. It wouldn't.
Oh, it just never
These get worse.
get worse.
The principle here, the teaching is that sports injuries like this have to be taken care of right away. Otherwise, the sportsman loses his ability. And the less you do with these, the worse they get. Ligaments work that way. And especially in shoulders. If you don't do anything with that shoulder, it's going to freeze up on you like that.
So this is going to extend to the shoulder at some
No.
point? Oh.
No, that's just an example.
Oh, okay.
So, all right, you want to do that?
Oh, yeah.
All right, we do it with the fluoroscope, so we'll take a look at it, come back. Oh, he's got a lot of it, too.
You didn't share that with me.
Oh, he didn't share that with me.
What's his handicap?
I'm not sure.
I have to mark you now. That's the radiohumeral joint, and the other one's up in here.
Did I present all the symptoms properly?
Good patient.
Oh, okay.
You know exactly what you're complaining about. But I know one thing I'm not going to do is play that game.
And side spin, so don't do that.
No.
Not the way you're doing it.
Not the way I'm doing it.
Yep.
It's strange that it almost looks like, I know it's not a knee, but I mean like the meniscus, and it has that look, kind of.
Yeah. That picture right there. Yeah.
Are we gonna see a before and after on this?
Yeah. We're just waiting a couple minutes.
What's the line?
That's a marker.
Oh.
Dee-da-da-dee-da-dee-da. They don't feel it. How about that? You didn't feel it already.
Wow.
All right, you can get up.
I still feel it here.
You can go all the way out, though, can't you? Yeah, that's nice. All right, let me knock that piece off. I didn't get it.
I can feel the pain in my down here. I still, if I make a fist, I still feel it down.
This.
Maybe grimacing.
Yeah, it's worth it though. It has to be in the spot. Elbows are real difficult because if it's muscular, you have to chase it. It's like 5, 6 places they could do it.
Okay. What should I not do?
Do everything.
Lift weights?
Everything.
Whatever it might, go back to a regular.
That's it.
But you never thought you'd hear that.
No.
You were ready to take 8 weeks off.
Well, one thing is we don't want you to come back. So we want to fix it today.
Okay.
Not that I don't like you, we just don't want to be that busy. So we're going to fix it and then go back, do whatever you want. Now, if your pain comes back or is it a different place, then you come back. That's
Right.
we chase
It's in
it.
the same place?
Yeah, we'll chase it for you.
Okay.
Sure. But that's
What did you
the.
just inject me with?
I'll give you a printout.
Okay. Cortisone? Steroid? Like a PED?
But
It's like a PED? Performance enhancing thing?
no.
No, actually, it's actually a bit.
I wish I could, but we
It's
know we
been
can't.
approved in all sports for not being that. Better?
Yeah.
Can you do the stroke again and say what you said?
No, I still feel a little here. I just
Yeah,
feel
it's-
it a little here.
Yeah, we got to chase it. It's muscular.
Okay.
You go in there. This is how you have to do this, not to ice it down or, even the pros, honest to God, what they do to themselves, it's craziness.
Chase, like you said, chase the pain.
Well, they don't have the techniques.
Right.
Surgeons don't do this work and the trainers don't do this work. See, so the professional players are really stuck.
Now, should I be feeling anything down here?
No.
Okay. It hurts to grip.
Yeah.
It hurts when I grip something.
Yeah, well, you gotta wait a minute.
Right.
If you watch your muscles when you grip, you gotta do that again. You see them all?
Yeah.
Where's that hurt now?
So you hit it one more time.
Okay.
Want the heavy club?
Yeah. Thank you.
I'm going to give you the guy's club though instead of that
That's fine.
female club. I'm just kidding.
I I feel pain.
Not as much. Now, you can,
Not as much, but it kind of feels like it did before last night, which was a nagging pain.
oh, okay, so it's reduced because of the
It's
shot.
reduced.
So what we
And
do,
also, it's like it.
Can you grip more?
See, it doesn't hurt with two hands, but it hurts with one hand.
still hurts?
What?
Now you have a shoulder.
Hang on.
No. I'm pulling my shirt.
Oh.
No, I'm not wincing on the shoulder. I'm just pulling my shirt. It got caught. There's no pain in my shoulder.
Yeah, I see you're chasing it now. All right, we did enough.
Okay.
Play though,
Okay.
and if it's a bother, you just come back.
Okay.
Otherwise, nice seeing you.
Thanks, Doc.
My weapon.
I thought it was you.
No.
Hey, what's it go?
Okay, Dr. Pannozzo, I saw you last April for this problem
You did?
yeah,
April?
April 15th, and then I was back again in May of this year.
What is your name?
Arlene.
Where do you live?
In Pompano, 3090 North Course Drive.
You have to drive.
Well, I don't have you. I didn't see you in April.
With me.
It was May 16th.
Yeah, right, you saw me then too. Okay. You had given me, you took an x-ray of me. You gave me 2 shots. Oh, it was 1 shot that you split in half on my left, in my neck.
Just tell me what your problem is today. You don't have to remind me what I did.
Okay. I have like
Jeez.
I have like pain under in here
Okay.
and here on my left
Mhm.
side. And I get this like cracking in the bone, it cracks,
Mm-hmm.
and then the pain goes away for a little bit.
Okay. Just to make it.
But like I can't, it hurts me when I have to pull my arms back,
Mm-hmm.
more so on the left than on the right. But I was here May, right? And he gave me another shot.
May and June. June was the leg.
Yeah, but that's not my problem now, right?
You're
This
right.
is this.
Okay. Okay, we never saw you for this. Well, yes, we did for the shoulder, the right shoulder. We saw you. All right, let's see. Drop it in my hand. There you go.
All right.
And down, go under. That's good. Hold it right here. Don't let me push it down. Hold it up. All right,
But
it's in the front. So.
The other side from that.
the other side is, it doesn't hurt that like this. The other side is, men's a men's. I can't.
All right. So it's in the front.
Whatever you say. You could feel it in the back, but it's coming from your neck, or you could feel it under here and it's coming from behind. You don't really know.
Well, you need
I
it.
don't know.
Yeah, you have to do a good exam. Did you bring your pliers in here?
Oh, I brought it.
I thought maybe you wanted to repair my.
I did it. I changed it.
Oh, it's much brighter in here.
Really?
Oh, yeah. I can actually see her. All right, you want a shot in there?
If you think that that's going to help me,
Don't hesitate.
I'm ready
It's a
to-
yes or no.
I'm
You
ready
better
to
say
do
yes.
it.
Come on.
I'm ready.
I'm going to hurt myself pulling this equipment around.
Yeah, well, you should show you doing
I
it.
should get the muscular person to do that for me. Yeah?
I told you.
You want a job?
I told you.
You want to do it?
You want me to do it?
There it is. Right there.
So this is not coming from my neck, correct?
No.
Why would you think it's coming from your neck?
Because last time when I came, I thought my pain in my arm, it was my forearm. You told me it was coming from my neck.
that was another issue. That
Yeah,
was
right.
had nothing to do with this.
So that's what I wanted to know. This is a new thing.
Yep.
That's why he re-examined you, so he knows that where it's coming.
Oh, yeah.
I practiced out my system this morning, surgery today.
This girl is so got it together. You notice I was doing all that. She never said a thing. Of course, her eyes got buckled. Oh! Okay. Watch that arm go right up.
Huh?
See, now I couldn't lift myself up. I mean, lift my body down.
Already.
Before.
Well, go ahead and put your arm up. Up, way up.
Up.
Yay!
There you go.
Good for you.
Yay!
Likes it.
Okay,
I didn't know that.
I just want.
That shoulder exam is unique to us. We developed that based on the anatomy and what causes the pain. Now, if you go across the street, you're not going to get that exam again. They'll do an MRI, they'll do all kinds of stuff. You don't need all that. You need basic medical stuff, which is history and clinical exam. And that's what she got. And then she got the treatment for it. So, what more do you want? That's it, baby.
I'm telling you that. I got my MRI. They found the nerves being
Who
pinched.
found it?
Orthopedic, my orthopedic doctor.
They depend on too much on MRIs. It don't tell you anything.
And my left arm is numb. Like hand and
What do you want me to look at today?
you gotta do my back.
Mm-hmm.
I can't tolerate
Just
pain.
put that over there so it doesn't spill.
Sure.
All right. How long has this been bothering you?
It started like 2 years ago.
Mm-hmm.
And then the right side, which is not out right now, it's been about 5 years. I threw out the right.
5 years.
Yeah, that's how long I've been dealing with this.
Wow.
And it goes out in your leg, does it?
This time, when I threw the right out, same thing. I had neuropathy, but nothing like what's going on right now. This,
Okay.
I can't feel any of this. This is all numb. This is all numb.
And your thigh, where is it?
No, the thigh's fine.
I can call you later, okay? You can probably call
And that, yeah, it's just like right up the kneecap down.
Can I call you like in
Can I put my feet up?
hours from now?
Can I gamble like that?
Does this wake you up at night?
All the time.
What?
All the time.
And how about walking,
Excruciating.
bending,
Excruciating. Very bad. Can't bend. Can't do tie my shoes. I can't do anything. My kids help me.
standing,
Standing is tolerable.
sitting?
The worst. That hurts me the worst.
You're sitting now.
Yeah, it hurts me the worst. It's horrifying. Like if I can't drive in the car anymore more than I could tolerate a half an hour. That's it. Then I have to get out of the car.
Any treatments?
I had I've actually had nothing done since this happened, but I had the epidural done once. Lots of pain meds.
Yeah, what did the orthopedic surgeon do?
He gave me an epidural in my spine.
He did.
No, the pain. The orthopedic sent me to the pain doctor.
Who
The
was
pain
that?
doctor gave me the epidural,
Who was that?
and that was all the way in Plantation.
Why is that?
Because that's who was under my insurance. It was horrible.
Are we in your insurance?
I don't know.
Oh.
Well, I have better insurance now. Back
Oh.
then it was different insurance.
Oh,
I'm allowed to go to anyone I want. Just co-pay for that.
this is Cigna.
Mm-hmm.
They're not going to approve anything. You have to get prior approval.
I do?
Cigna, yeah.
I don't have a HMO, I have a PPO.
Well, if you want your back treated, they're gonna have to approve it.
So how does this work?
Well, it doesn't work.
I wish I would have known. I don't want to waste your time.
You're not wasting my time, just pay for it. Why you let your insurance tell you what to do? Huh?
How much
Think
is
about
it?
that.
Okay, how much is it?
It'll be around 450. Dr. Pannozzo. Well, we're guaranteed this is gonna come out. All you have to do is guarantee payment.
I can guarantee payment. Is it going to be $450 each time?
No.
Okay.
But in other words, if you had a better insurance and we knew they would cover you, we just submit it and they would pay you.
Yeah, I pay
But
I pay a
Cigna-
lot of money a month.
But Cigna,
Like
you
$800 a
you
month.
got to drop Cigna and get Blue Cross Blue Shield.
They wouldn't take me. I called.
Blue Cross Blue Shield
Yeah,
wouldn't
they're
take
like,
you.
they said we do more group members.
I don't think they would. Call again. Have a seat.
Okay.
I'm going to rotate your hip here. Are you a diabetic?
No.
You can't have a neuropathy then.
I had gestational diabetes 4 times.
Well, everybody gets that. But this, you can't have a neuropathy. First of all, you're too young and you don't have diabetes.
Okay, so why is it numb?
Well, we're going to tell you that in a second.
Okay.
That's why you want to stick with it. Stand here.
Stand.
Face this one. Hold this up. Okay, go ahead and bend forward now. Create a pain if you can. If you get a pain, put your finger on it. Go ahead down. Where does that hurt? Right there?
Mm-hmm.
Okay, come back up. Back this way.
Mm.
Where does that hurt?
Yeah.
Up there. Oh, how about down here?
Yeah, okay.
Where?
Okay, here.
Left. Okay, bend left
Okay, yeah.
and right. Does it hurt going to the right or left?
More to the left. Now that hurts my right side. I'm hurting on both sides of my back, I think. The left
There's
is
always a
really-
primary and a secondary.
Yeah, this is just out, like gone.
Okay, you had chiropractic treatment?
No, they wouldn't take me. The guy said he wouldn't treat me.
Chiropractic?
Yeah.
They treat everybody. What?
No, he said he wouldn't. He asked me if I had, he asked me if I had herniations, and I said yes. And he said, I'm not touching you. That's what he said to me.
Where? How would you know that?
That's what he told, because the doctor told me I had, all these L's herniated
MRI.
in the MRI. From
Yeah,
what
they're
they-
misread.
Okay,
You don't have all that.
I don't.
No. You
What's
have one
wrong?
spot.
What's wrong with me?
Well, I'm going to tell you. You have one spot. I think it's between the 4th and the 5th bone, and we knocked that out in one day.
Get out.
I
Doing
know.
what?
I can't get out. I have no place to go.
Oh, that's my belt.
Oh, for a crying out loud.
Should we have taken that off?
Yes, you should have.
Well, you have to tell me. I don't remember these. You want to do another one? Or can you see that?
No, I can see. We're just looking at your hip here.
My hip's killing me, by the way.
Your hip is not killing you.
Huh?
Your hip is not killing you.
No, my hips hurt me bad. I
Your
want to
hip,
know if I have the arthritis or something.
your hips do.
What?
Can you grow up a little bit?
No, I'm a child. I'm great. I'm a good person. I laugh a lot, despite this bullshit pain I have.
But well, it isn't.
What's wrong with me? Look, I'm crooked.
Your hips are normal.
Maybe it's the belt that's crooked. It's really not.
The pain is coming from right here.
I keep thinking that's my phone. It's the same way.
Well, that's good that it's from where it is.
Dr. Pannozzo.
Instead of from your hips.
What is this?
I don't know, you're wearing a necklace.
Oh, my bra. That's my bra. See?
Yes, yes.
Those are the metal pins in my back. Now I guess I'm all messed up right there. Oh, look at that.
I don't remember. What did I see you for?
So he'll inject you there.
No, not that I was going to
No, you'll feel so much.
Oh, I saw you for your hip.
It hurts for 3 seconds.
Did I put a shot in it?
It's really not. I
I'm
wouldn't.
needle phobic. No, I'm
We had 2
What?
needle phobic ladies I wouldn't just say that.
I'm needle phobic now.
What's your whole name?
You won't even see it. You'll be on your stomach.
Taylor. Oh, yeah, I remember. Yeah. What about it?
You don't want the pain.
Yeah. What do you want to know?
I mean, you'll be glad you did. You'll be glad you did.
It works.
It works. I can't even explain what he does. It's just videotaping it. Because I can't believe what I'm seeing all the time. I'm voluntarily doing this. I can't believe this. That's how much I believe.
No, we completed your shots. Okay, there's no problem there.
My first wife had 750 diseases. Second wife got the whole breast milk.
It is. But you have to know how to read it.
Yeah, it's all crooked. It looks like I have scoliosis.
If you had scoliosis.
It looks like it's going like this. Why is it tilted right there?
Because that's where your injury was. You fell on that. Yada-dee-da-da-dee-da.
And my hips look good to you?
Yes,
Really?
hips are good.
So I have a crooked spine?
Yeah, it's right here.
What
No,
is-
this is trauma. It's not a crooked spine. It's you damage this by a fall. That scar tissue you're looking at, white.
Really? Trying to think. I only fell once. Oh.
Well, that's it. Now, if you wanted your insurance to pay for this, I would have to send them the picture, send them a description, and they would have some idiot over there. I don't even know where they are.
Yeah.
Would
Oh,
it-
it's
would it-
horrible.
Or approve it or not
I
approve
can't
it.
stand
And
it.
if I told them it was certain things we do that they don't do, you don't get approved. That's the kind of insurance you have. Your best bet is to get out of that. My secretary told me. She said if anybody with Cigna comes by, it gets cash only because they don't pay.
Okay, well, hey. So what is this called? What do you call this?
Scar tissue from a fall.
So
That's
how do you
what I
get
just
rid-
told you.
Yeah, but how do you get rid of it?
by shot.
Ugh. You don't like it.
You'll be fine.
You're 47 years old.
I'm not.
Stop that. You're acting like a 12-year-old.
It's work. I'm not even acting bad yet. Wait till you
Oh,
pull out the needle. Let's grab onto him. Come here.
no. Grab onto the table.
I need to pinch something.
No, you
I'm
get-
gonna pinch my
Stop it. Stop it.
my penis.
You got it.
Get it over with.
I'm trying. If you stop moving, we can do it.
I'm not moving.
That's the
I
marker.
can't do this.
He hasn't even done anything.
You gotta,
I can't do
You're
it.
fine. You're
you gotta
fine.
quit swearing.
Think about the beach or something.
No, I like
The
to
ocean.
curse. It makes me feel bad.
You gotta quit swearing.
Why?
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 That's so
Ah!
much more.
Okay, Maria! Maria! Ow! Ow! Are you done? Are you done?
No, that was a practice session.
Are you done? Seriously, he's done? Oh God, Jesus, thank you, Lord.
No, that was a practice session.
No. Are
Now
you done?
we gotta do it real.
No. Are you done?
We gotta do it for real
Honestly,
now.
God, I hate you. Oh my God, I hate you. Oh my God. God.
I'm back the other day.
Oh God. Can I get up? Ow.
Wait till you put the band-aid on.
Yeah.
You don't want
I feel funny. It feels funny. Oh. Oh my God, am I healed?
You are.
to
Really?
give it a few minutes and you'll be able to do things without pain that you couldn't do.
Are you serious? This is it for me? Like I'm cured?
That's it.
Oh my God. Is that for real? You're really being serious?
Yeah.
I'm gonna make you my sauce.
Oh, good.
And I'm gonna bring it over and do you a big thing of pasta. What's your favorite pasta? What size? What shape?
What size? The real thin one.
Oh, you like angel hair?
Yeah.
I will make you my sauce and angel hair and bring it over
With
to you.
meatballs too.
No, really. You have no idea. I was raised by Italians, only Italians, and I'm an excellent cook. You won't be upset. You'll be so grateful.
I'm depending on it because we have to go to lunch every day.
Yeah.
All right, turn over.
Okay.
Turn over.
Okay.
Look at the screen.
It feels a little weird.
Oh, it will, because you just have some medicine.
And you can't afford
I sit up?
jeans. Is that why you?
I made these myself. Aren't they sexy?
Sit up.
Okay.
Now you see where the marker is? Right there.
Mhm.
See the black?
What is that?
It's inflammation. So we just knocked that inflammation down. And this will start moving better. This is what was bothering you down the side of the calf.
What's the black thing? Is that
It's a
the
marker.
needle?
It's a marker.
Oh.
It's this.
It's this thing. Just marks where.
Oh, I got you. I got you.
I made that out of a.
So that black, all that black is what?
On the right, inflammation. That's where you're in. That's where your pain's from.
Oh, so that means it's swollen.
Cause some
And we
scars.
just knocked the pain down.
So I don't have to take any more pain pills?
Of course not. You never had to take any in the first place. It's not that bad. Okay, you gotta go. We gotta go home.
All right, gotta cook dinner. Make
I'm
you
really
broccoli
tired.
soup.
I've been working all day.
That's funny.
Mean, horrible doctor injures patient. Where's my purse? So where'd I leave it?
What?
Your pocketbook?
Yeah. Are you from Boston?
How can you tell?
Oh my God.
I parked my car out.
It's not that you don't have much of an accent.
But everybody picks up on it. I
Well,
got
you
enough.
just said. Yeah. What did you say?
Parked my car.
No, you said pocketbook. Pocketbook.
Pocketbook. Is that your pocketbook?
Is that your pocketbook?
How am I supposed to say? Is that your pocket?
Well, New Yorkers just say pocketbook.
Pocketbook.
Actually,
Pocketbook.
just pocketbook,
Pocket.
not pocket.
Pocketbook.
Don't film me. Please.
Stay here? You sit there.
All right. What kind of trouble you having? Where do you live?
In Deerfield.
Where?
Deerfield Beach?
Deerfield.
Mhm.
You didn't write it down, did you? Or is it? Oh,
Yeah.
you got to put Florida.
Oh.
What's your zip code?
33442.
33 what?
442.
3
33442.
33442.
Yes.
Got it. What do you do? You're a technician?
Yeah, I'm auto glass technician. Replacing glass for cars.
Autoglass. Is that the one that you have a bunch of girls go out to dance? They do it in the parking lot? Is that the one?
I would like to.
That's safe flight.
What do you want me to do for you?
Okay,
Me?
me. I'm a tennis player. I like to play. I used to play almost every day.
Play what?
Tennis.
Tennis.
And 5 weeks ago, I was practicing in hardcore.
5 weeks ago?
5 weeks ago. And I practiced, I finished, nothing snapped, I didn't feel anything different. But I just feel a lot of pain at night when my body cool down.
Trying to relax.
And then it started to get swollen.
and put a lot of ice. The next day, ice. Next day, I couldn't walk very well.
Which knee is it?
The left one.
Left.
Now I have no pain. I see when I walk, no pain, but I cannot do anything. Like I cannot run. I cannot put weight on it. But I can walk very well.
You have trouble climbing steps?
Yes.
That's your big trouble?
It's a big trouble to run, to put, in my work, I have to climb over the cars, up and down, and that's when
Let's see. No, sit. Oh, man, that's a heavy leg. Does that bother you up here?
Yeah, right there,
Right there.
right there.
How about this one?
One's okay.
This is not your knee. Your knee is good. This is a patella.
Patella?
Kneecap.
Okay.
Under the kneecap. And that's it. You want a shot at it?
I don't know, what do you think you have to do? If you ask about your window glass. It's, cause probably I know that if you take it longer, they're gonna recover by itself, but like I say, 5 weeks.
They don't, sometimes they get better, but you're not gonna be able to be active with that. And this will bother you more and more climbing steps
Mm-hmm.
and getting out of a chair. Because that's not a knee function, that's a patella function,
Okay.
the kneecap. So that's how you take care of it.
Easy one?
Yeah, sure. Yeah, no contracture or anything, and your hip is okay. Yeah, okay.
I do have some problem in the hips, but it doesn't bother me too much.
Well, if you're gonna play, what do you play?
Thanks.
Tennis. Well, if you play tennis, what about it? He's a tennis instructor.
You know what I'm talking about. You know, I used to play just in clays, but I should be playing this weekend a tournament in Orlando, and it's gonna be a hard court. And I started to practice hard court, but I don't think my age let me play in hard court anymore.
Oh, I don't know, we can fix this.
The knee will have him do your knee.
Not a problem.
And then, you know, it's
I would have him do your hips too if you have a problem with your hips.
it's not that much. It's not.
Well, I didn't find anything. I'm looking for it. It's good. Okay, stand right here. You don't have a backache too, do you? Turn right around. Go ahead and bend forward. And go backwards. You hurting right there? Come backwards. Back, over my hand. Bend back. Oh, that's good. You don't feel anything, right?
No.
Okay, go left. And to the right. All right, good.
Over here is something. If you start to little jumps too.
That's right. You're after I inject this, you can do squats, stretch it out.
Mm-hmm.
Yeah, don't be afraid of it. Just squats and they'll stretch them out.
And how much gonna cost me? Sorry, thanks, baby.
It's gonna cost you $100
Perfect.
right now. You have a problem too?
No.
You just
It was my little son.
trying to protect him.
Exactly. He's a good fighter.
Okay, just bring the pillow here and lay down.
There.
How long have you been playing for? Are you playing in an open tournament or?
Yes, you know, actually, this weekend is the USTA finals in Orlando.
Oh, really? What's your rating?
It's 4-5.
Good.
When I was up there, played baseball.
How about this or as opposed to this?
No, it doesn't feel the pain.
Neither one?
Neither one.
Well, this is where you said it would hurt you right here.
Yeah, but it's like under that.
Yeah, it's underneath.
Yeah. Ooh, that hurt.
Was that the place?
Yes, sir.
Get up, move around, walk and see how it feels. Do what you do that causes you the problem.
How was that?
What you did? That looks like good to me.
Yeah, it's gonna get good, better and better overnight, and you won't have any more trouble.
Really? I hope so.
4, 3, 3, 4. All right, just below, between, just below the screw here. 5, 4, 3, 3, 4. Okay. This, Mr. Roach has what we call a chronic condition. It's a scar tissue from a fusion that they did. And this is all inflammation from that surgery. So we're just tracing it down to where it occurs, and we relieve it, and you get relief?
Yes.
Yes, and it gets less and less pain all the time. So he comes in. But in the musculoskeletal business, you can get as good as you want to get. If you want to get good, it takes more effort than not. But as long as you improve incrementally, that's what you want.